You know, guys, I find it very weird that the ANC is so obsessed about the national health insurance, and the ANC honestly wants average South Africans to believe that they can deliver the national health insurance despite the national health insurance being such a big deal with a lot of money involved. The ANC, for some reason, they want the average South Africans to believe that they can deliver the national health insurance. And what is weird is that for the longest time, the ANC has been avoiding to have meaningful conversations about the state of our healthcare facilities. I'm sure that many of you guys saw this video that I'm about to play you. This is a video that was took in Helen Joseph Hospital. It was took by a gentleman called Tom London. In this video, Tom London is going to show us the state of the ward that he is in, and he's also going to tell us about the attitude of the doctors towards the patients there in Helen Joseph Hospital. So while the ANC is lying to the average South Africans about the national health insurance, this is what average South Africans are subjected to whenever they need medical attention.
I'm doing this video a little earlier than I thought because of what's going on in the ward at the moment. So welcome to the Helen Joseph Circus Hospital. These are the bathroom facilities for Ward 8. There's the bath. There is a cold tap which works, but no one baths here. I don't know what that door means or where it's supposed to go. Your basins. These are the toilets you get to choose from. You get to choose from toilet 1 or toilet 2, which is a bit better this morning. There's the toilet paper. I was rushed here on the 25th because I had pneumonia. Went to my GP, treated me. Treatment didn't work. And as my antibiotics ended, I went into respiratory distress on the 26th, Sunday morning. I was rushed to this hospital where I landed up in casualty. I slept in casualty for 3 days. There were no beds. I had no pillow, I had no blanket. I think on the second night a nurse brought me a blanket. I lost control of my bowels. There were no bathroom facilities, so I lay in my own feces for a day before I kicked up such a fuss that they moved me to Ward 8. I then got a doctor who never introduced herself to me, had very little to say to me, and then a few days later told me that she was being rotated to another hospital. That's when I received Dr. Pillay and Dr. Van Eck, who I believe they treated me quite nicely. But I've been watching the treatment by the other doctors. The gentleman in the bed diagonally opposite me, who is he's crashing at the moment. 2 days ago, a team of young doctors, 5 doctors, came to do a lumbar puncture on him. Sorry, I'm out of breath, so I'm going to sit on the bath for a while. They came to do a lumbar puncture on him. And while they were sticking needles in him and straining him, while he was screaming like an animal, they were discussing their bonuses. They were discussing their cars, and they were discussing the restaurants nearby that had really great food to eat. They were laughing and joking, while the guy diagonally opposite me was screaming his lungs out. The guy opposite me, he has a doctor who comes in every day and goes, "Did they take your x-rays today?" And he goes, "No." And you go, "Did they take your blood today?" "No." He doesn't say good morning, nothing. The doctors that run around here, they treat the patients like cockroaches. No doctor, I haven't seen one doctor walk up to a patient in our ward and go, "Good morning, Mr. So-and-so, how are you?" Nothing. They treat the patients with absolute disdain and disrespect. I'm talking about this from the young Wits medical students all the way up the chain at this hospital. I have never seen a level of disrespect for human beings like this in my life.
And I wish I could say I'm shocked, but the truth of the matter is that I am not shocked by the revelations that are made by this gentleman. Unfortunately, it had to take this gentleman to speak out about the conditions in Helen Joseph Hospital, for the media to start paying attention to what's really happening in our public hospitals. But truth of the matter is that this is something that South Africans have been talking about for the longest time. South Africans have been complaining about the state of our healthcare facilities for the longest time. There are so many stories like this. South Africans have been complaining about the attitude of the doctors, of the nurses in our healthcare facilities. So I wish I could say that I am shocked, but truth of the matter is that I'm not shocked by these revelations. The only thing that is actually shocking me is that for the longest time, the ANC government has avoided to have a meaningful conversation about the state of our healthcare facilities. This is the only thing that has been shocking me, and it continues to shock me that till today the ANC still won't talk about the state of our healthcare facilities. It is so sad what average South Africans are subjected to. It is so sad. You think about it, man. When the politicians need medical attention, they go to the private hospitals. When politicians need medical attentions or their family members need medical attentions, they go to the private hospitals. They even go overseas to get the medical attention. But they don't care about average South Africans being subjected to these kind of conditions. It is so sad. It is so sad. There are so many stories, man. You see, when about this story, the other thing that I really find absurd is that the Gauteng Health Department came out to say, yeah, now we are launching any investigations about these claims that were made in Helen Joseph Hospital. We are on top of this issue. As if Helen Joseph Hospital, it is the only hospital that's in this condition in Gauteng. This is not the only hospital that's in this condition in Gauteng. You look at the public hospitals across the country. This is what the public hospitals across the country look like. This is what the public hospitals across the country look like. So when the Gauteng Health Department comes out and pretend like we are on top of this issue, we have to really look into these allegations of poor conditions in Helen Joseph Hospital, pretending like this is the only hospital with these sort of conditions, it really shows you that these people do not have the intention to actually fix these issues. They do not have the intentions to fix these issues. But it is so sad, man. It is so sad that the people that are voted into power by the masses of this country are not dealing with the same conditions. This is why I remember before the elections, this is one of the conversations that people were having, that how about we subject the politicians to the same conditions that they expect us to be subjected to? The day we take politicians' children and put them into private schools, into public schools, they will really get to understand that there needs to be a change in public schools. The day we demand the politicians to go to the public hospitals whenever they seek medical attention, they will understand that there need to be a change there in the public hospitals. But as long as we are okay with the politicians to go to the private hospitals whenever they need medical attention, these issues will never be solved. These issues will never be solved. It is so sad. It is so sad, and I thank this gentleman, and I don't know what actually triggered him to actually make this video. No, I know what actually triggered him into making this video. I don't know what actually triggered this video to actually go viral, because many people have been making videos in various public hospitals. But this video is the one that actually forced the people to now look into the conditions of our public hospitals. It is so sad. It is so sad. So sad. While the politicians are debating about the national health insurance and lying to the average citizens of this country, telling them that if you need medical attention next time, you will just have to provide a government card, then you can go to the private hospital, you can go to the private clinics, ignoring the same public hospitals and clinics that they destroy themselves. It is sad, and our people are falling for the same lies. They are falling for the same lies. You look at the ANC, you look at how they destroyed the state-owned entities. For people to actually think that right now the ANC can deliver the national health insurance, it's absurd. It's absurd. What is it that these people have actually delivered for the people of this country? Is there a single thing that these people have delivered to the people of South Africa. Clean so. So what actually makes people believe that Aaron Motsoaledi and his comrades in the ANC, they can deliver the national health insurance? It makes no sense. The national health insurance is being used to avoid to have a conversation about the state of our public hospitals. The national health insurance is something that is being used to actually having to run away from having a conversation about the state of our healthcare facilities. Nothing more, nothing less. Nothing more, nothing less. This is why people, every time when the ANC starts to speak about the national health insurance, people are saying, why are you guys so obsessed about the national health insurance, whereas we have these problems that are facing the people on the ground? Why are you people so obsessed about the national health insurance? These are the conditions that people are facing on the ground. And who is responsible for Helen Joseph to be like this? Who is responsible for Helen Joseph and 1,000 other hospitals to be like this? Who is responsible? Who is responsible? And are those people going to take accountability for hospitals being like this? Are they going to take accountability? No, they are not. They are not going to take accountability. They are not going to take accountability. It is so sad to see that these are the conditions that our people are being subjected to. The people that are currently in public hospitals are dealing with these conditions as we speak. Right now, as we speak, the people are facing these conditions. They are facing these conditions. It is so sad, man.
Yesterday I was taken down for a CT scan to check if I've got cancer. I had the CT scan, I was brought back up. A few hours later they came back, said, oh, we made a mistake, we forgot to put the dye in you. So I went down and had another CT scan. Now, I've been dealing with my doctors, Dr. Pillay and Dr. Van Eck. Every day they come and report back to me, they tell me what they're doing. Yesterday, a blonde doctor, some young blonde white doctor, she comes to my bed, looks at me, ignores me, starts writing in my file for 10 minutes, says absolutely nothing, and then announces that Dr. Pillay is no longer my doctor, I've got a new doctor. I asked why, and she said that he has handed his patients over to less complicated patients over to someone else. And she gave me the doctor's name, I can't remember. I haven't seen that doctor for 48 hours, so now I haven't had a doctor for 48 hours. Dr. Pillay, I don't know, Brew, you came and spoke to me every day. Just 2 days ago you said we're going to look awkwardly at each other for the next few days until we have your CT scans, and now you've ducked. Someone told me that you're writing exams at the moment. I don't know, right? The guy opposite me, that doctor that comes every day, treats him with absolute disrespect. He's a human being who, when he talks to this guy who is in constant pain opposite me, he talks to him like this. The guy opposite me goes, I'm in so much pain, doc. And the doctor goes, oh yes? Just like that. Nothing. No doctor here calls you by name. Every doctor here assumes you're a hobo that's come off the streets. The doctors here are behaving like the patients are their little experiments. I've never, ever experienced anything like this in my life. I'm going to take you into the ward, and I'm not going to say much, but I'm going to show you some of the crap that's going on in this ward. Give me a second. Let's go to the ward. Oh, by the way, I'm lucky to be talking to you on this phone, because last night as I was sleeping, a woman came into the room, took the phone from right next to my head and stole it. Luckily, the guy opposite me saw it, woke me up, said, Tom, someone's just stolen your phone. I got another guy to call it, and I heard it ringing from down the passage, and I tracked her down to a ward where she was trying to remove the SIM card. So I'm very lucky to be talking to you on this phone. Let's go into Ward 8. The doctors here, you give doctors a bad name. All of you. Despicable human beings. Right? Here. Taps. What, do you think it works? Nah, that tap doesn't work. Let's check the ceilings out. Well, they're peeling and flaking and stuffed. Right? All of this is rusted. This is my bed. The plug doesn't work, it's blown.
And guys, this is the treatment that people are getting from the government that pretends to care about black people. You remember even during the elections, they told the South Africans to vote by color because they love them, because they are the custodians of black. But these are the conditions that people are subjected to by the same government that pretends to care about black people. So who do we blame? Who do we blame? Do we continue to blame the ANC for actually subjecting the people to this? Or do we actually hold the people accountable for and saying that this is what you guys actually voted for? You have decided to ignore all of these issues that South Africans have been complaining about all of these years. So it's your fault, partially. You have to take the fault. You have to take the fault. Who do we blame? Who do we blame? Because we can sit here and complain about the ANC all day. We can complain about the ANC all day. But are people actually going to take accountability for actually putting these people into power? Are they going to take accountability for putting the ANC into power for the past 30 years? Because this is not the first time someone showed us something like this. You remember last time there's a video that was all over the internet showing a mother that died, a mother that was tied by the bed like a dog, and she died sleeping on the floor. She died sleeping on the floor because someone in the hospital thought it would be a good idea to tie her leg and a hospital's leg down like a dog and allow that old lady to die. So who do we blame? Who do we blame? Because right now, as we speak, people are outraged. How can this government subject the people to these kind of conditions? But truth of the matter is that this is how the hospitals have been for a long time. This is how the hospitals have been for a long time. I remember even right now, there is a popular artist in the country that has died. And according to his family members, the guy decided to die at home because he wouldn't go to a public hospital. Even where I stay, there is a hospital that is quite notorious about these kind of conditions. And where I stay, the people are deciding to die in their homes because people are saying, no, there is no way I'm going to go to that hospital. There is absolutely no way I'm going to go to that hospital. If I'm that sick, I would rather die at home. If these people do not take me to Bloemfontein, I would rather die at home. Many people have decided to die at home instead of going to the hospitals because the hospitals are not even inspiring any confidence. When you go to the hospital yourself, you can see that there is no order in the hospitals. The nurses and the doctors are doing as they please, walking up and down and laughing, making noise, while people are sitting in the benches in pain. People have lost their children in the wards waiting for the doctors. People have lost their lives. People have been stabbed and lost their lives sitting waiting for the doctors. This is not new. But it is very absurd that when it comes to voting, South Africans would just decide to ignore all of these issues and pretend like these issues are not happening. And after they have voted for the government that have subjected them to this for the past 30 years, they will cry and say, no, how can this government treat us like this? But truth of the matter is that you brought it to yourself. You brought it to yourself. This thing of majority rules, it is never going to help South Africa. It is never going to help South Africa. I remember the last time I said, maybe we need to cut the country in half. The people who want to live under the ANC rule, they can go and live under the ANC rule, and other people, maybe they can go on the other side. And maybe it needs to be like that, because the majority rule, it is not working. It is not working. The poor South Africans, the poor black South Africans are voting for the ANC despite everything that these people are subjecting them to. They are voting for the ANC. Look at what is happening in the Eastern Cape. As we speak right now. People are complaining that there is no water, the dams are dry, and all of these issues. But if you go and look at the voting logs, you see that the Eastern Cape has given the ANC over 3 million votes. The ANC has gotten 6 million votes across the country. The Eastern Cape has given them half of those votes. But today, the same people in the Eastern Cape, they are crying because there's no water in the taps. They are crying because there's no water in the taps. So who do people actually blame when something like this happens? Who do we blame when something like this happens? Because people can come out and complain about how bad the situation is. Yeah, how can the ANC subject us to these kind of hospitals? Why can't the ANC take care of the hospitals? The ANC doesn't love people. But truth of the matter is that you people voted for the ANC. You voted for the ANC and you don't want to take accountability for actually voting for this. Now people are outraged. They see these videos, they see everything that has been revealed about the Helen Joseph Hospital, and they are outraged at the government. And I'm sitting down and I'm like, but truth of the matter is that you voted for this. You voted for this. So who do we blame? Who do we blame? Who do we blame? In this country, we have this tendency of voting the same way, ignoring the problems that happened, but we continue to vote the same way. We vote the same way. The people in KZN, some of the communities in KZN, they were marching with the ANC. Marching for what? For unemployment. The ANC has been in charge of this country for the past 30 years, and the people are marching with the ANC. Oh, we want jobs. We want jobs. Who do you actually expect to offer you jobs? Where do you expect those jobs to come from? You have been voting for the same way. The investors have been leaving this country. Whenever the reports are coming that the investors are leaving this country, people will say, no, those investors are nothing but racist. We are not going to listen to those racists. The racists can leave. Then what? The investors, they take their money and leave South Africa, and people are losing their jobs. As we speak right now, people are not finding jobs. People are losing jobs. People are losing jobs. But when someone comes and says that, guys, the investors are leaving the country, the people will say, no, we don't care about the investors. We don't care. Don't tell us about those racist investors. People are deciding to be ignorant. They vote today, ignoring all the problems that have been facing them throughout the years. And tomorrow they will be protesting for the same issues. They will be protesting for the same issues. So now we are talking about the conditions of the Helen Joseph Hospital. But the truth of the matter is that these conditions are not new. This is not new. We've known about these issues for the longest time. We've known about these issues. We've known about them. We are not surprised. Some of us, we are not surprised. People who have been following this platform, they know that I have been talking about these issues, even heading into the elections, especially when the ANC was ramping up the issue of the national health insurance. The people that have been with this platform way before the elections, they can tell you that these are some of the issues that we have been obsessing about, because we actually wanted the people to vote different and say, you cannot vote the same way. Please, man, for the love of God, you cannot vote the same way. But no, they are voting the same way. They continue to vote the same way. And today, the same people that have voted for this are crying. They are crying. So what do they expect the South Africans to do? What do they expect South Africans to do? That's why I'm saying this majority rule, it is not working. It is not working. Let's be honest. Majority rule, it is not working. Majority rule, it is destroying us as the country. Let's be honest. Let's be honest. Let's cut the country in half. If you want to live under the ANC rule, go and live in the municipalities and the cities that are governed by the ANC. If you want to live in an alternative government, you can go on the side and live on that alternative government. Let's be fair. Let's be fair. Let's be fair. Because the majority rule, it is not working for the poor citizens of this country. Majority rule, it is not working. It is not working. It is not working. It's not working. The noise that people are making on social media when they are talking about what is happening in Helen Joseph Hospital, it is not the only hospital that is facing this condition. It is not. It is not. Many hospitals, many public hospitals are facing the same issues. It is not. It is not the only hospital that is facing the same issues. It is not. It is not. We are not going to sit here and pretend like this is the only hospital that's in this condition in the country. We are not going to do that. We are not going to do that. We can simply go online and see how many hospitals are like this in Gauteng. Just look at Baragwanath. Just look at Tembisa Hospital. These are cases. They are the same. They are the same. If someone can wake up tomorrow and shoot a video showing you what's happening in Tembisa Hospital, you will be shocked. You will be shocked, but some of us know that these are the conditions that are facing the people. This is what the people are subjected to. This is what the people are subjected to. You know, sometimes, as much as we like to speak and be compassionate about what the people are facing, but sometimes we really have to make people face we have to make people face their own actions, because they voted for the same government. They did. We are not happy that these are the conditions that people are subjected to. But the people that are making the noise, they don't have the right to make the noise. Most of the people that are making the noise, they don't have the right to make that noise, because they continuously vote for this. And now that they are sick and tired of the public hospitals being like this, they are saying, no, the ANC is going to deliver the national health insurance. Next time, when you need medical attention, or if your family member seeks medical attention, you will simply go to a private hospital with your government card. Everything will be paid for by the ANC government. It is for free. Everything will be paid for. It is unconstitutional. It is unconstitutional. But people still, they don't care. They don't care. They don't care. The courts they said, man, throw that nonsense out. Throw that nonsense out. When Ramaphosa signed this bill into law, even before the elections, we had a lot of videos about these issues. Before the elections, we spoke about this countless times, and I told you guys that the only reason why Ramaphosa would sign a bill like this into law was simply for him to go out and campaign and tell South Africans that, guys, this is what the ANC government will be bringing to you. You remember, just like with Jacob Zuma. Jacob Zuma said, no, we are signing a free education into law. Free education into law. Free education into law. How many students died fighting for the same free education that Jacob Zuma promised them? How many students died fighting for the free education that Jacob Zuma promised them? How many of them? Fees must fall. When was fees must fall? When was fees must fall? The students were actually arrested. Many of the students, as we speak today, they have criminal records dating back to the fees must fall. But today, they are the same members of MK Party telling us that, no, Jacob Zuma will deliver to us a free education. This is how the people are like. That's why I'm saying, let's cut the country in half. Let's cut the country in half. The majority rule, it is not working. Majority rule, it is not working. It is not working. The people who actually have sense in the country, they are a very small number of people who really have sense, people who want change in this country. It's a small number. Truth of the matter is that majority of poor black people are okay with everything that is happening in the country. They are okay with everything that is happening in the country, because if majority of poor black people were not happy with how the country is like, they would have voted different. They would have voted different, but they voted the same way, meaning they are okay with everything that is happening in the country. But it is not fair to actually subject other people who want change in these conditions. It is not fair. It is not fair. It is not fair. Cut the country in half. Cut the country in half. It's too big. Cut the country in half. It's too big. If you want to live under the ANC rule, under the radical economic transformation rule, go this side. Go this side. If you want to live under the free markets and the economy, thriving economy, go this side. Let's cut the country in half. Let's cut it. Let's cut it. Let's cut it. If you want free land and free farms and free everything, just go this side. Just go decide. If you want the free markets, just go decide. Let's cut the country in half. Majority rule, it is not helping us. It is not. I get frustrated when I look at these issues. I honestly get frustrated. I am sick right now, but I am compelled to making this video because it makes me sick every time I will look at this video. My stomach will literally turn. My stomach will literally turn and think about the fact that the people are the ones that are subjecting themselves to this. The people are the ones that are subjecting themselves to this. They are the ones. So let's cut it in half.
That's all rusted. I am so angry with you. This is the Helen Joseph Circus Hospital, where doctors experiment on you. Now, earlier on, I put a video up of the guy opposite me who was busy dying. I'm going to turn this camera around, right? He's dead. He died 20 minutes ago. He's lying there in that bed. He's actually gone. He's dead. Now, our government wants us to believe that the NHI is going to do great things for us. But here's just a few minutes in the day in the life of the Helen Joseph Circus Hospital, where the doctors talk about their cars and their clothes and their bonuses while people lie dying in front of them. When the doctors left the ward now, after this guy just died, they were laughing. Shame on you. Shame on you, Helen Joseph Hospital, but mostly shame on the doctors that think they have the right to call themselves doctors, that run around this hospital and treat every single patient like a cockroach. You, doctors, you're the cockroaches. You actually don't deserve to exist. Not the patients you're busy experimenting on and killing.
So guys, the Minister of Health, Agwadi went to SABC to address some of these issues that people have been complaining about, and I just want you to,
but
I just want you to see how the minister actually responds to these issues that are so important to the people of this country. Just look at the minister, look at his demeanor, and please tell me if you think there is compassion in the eyes of the minister. Please tell me if you think there is compassion in the eyes of the minister.
Facilities is yet again. The dire state of patient clinical care at some public health facilities is yet again receiving public attention. This after a video of a patient, Tom London, went viral, relating his experiences and alleged poor conditions at the Helen Joseph Hospital in Johannesburg. London described the atrocious facilities and alleged that the staff treated patients like cockroaches. The Gauteng Department of Health said that they are willing to subject London's clinical treatment to independent evaluation, and also that infrastructure issues at its facilities have no effect on treatment given to patients at the hospital.
Who believes that? Who believes that? Who believes that?
To talk more on this and the state of our public health facilities, we are joined by the Minister of Health, Dr. Aaron Motsoaledi. Minister, thank you very, very much for your time and welcome to the program.
Thank you, Leanne. Good morning to you. Good morning to the listeners and viewers out there. And
Minister,
thank you very much for having me.
It's an absolute pleasure. Thanks for heeding our invitation. So, Minister, obviously this has just prompted a big spotlight to be shone on the public healthcare situation here in South Africa. I don't necessarily want to focus on Mr. London's allegations. I really, really don't want to talk about his case, because there are tens of thousands, if not millions, of other South Africans that have spoken out against this on a daily basis, and it seems to fall on deaf ears. But Minister, let's get your response to the latest dire patient allegations at Helen Joseph Hospital.
Well, Leanne, it all broke our hearts. It was quite disappointing. But under no conditions are we going to condemn the whole public healthcare system because of what happened in Helen Joseph. Because, Leanne, there are millions of South Africans who have gone through our hospitals and were treated and were sent home. For instance, every year, 1,060,000 pregnant women go through our hospitals and deliver babies, most of which without any incident. So we are not going to sit here and argue that we don't have problems. We do have. That's why we want changes. That's why we want to introduce universal health coverage so that we cover everybody financially. Because at the present moment, we are running a healthcare system whereby there are parallel healthcare systems, whereby one healthcare system is having huge resources for 14% of the population, but 86% of the population don't have those resources.
Yeah.
And Helen Joseph within that 86%, and that's why we want to change that system.
Yeah.
But why is the minister acting like there is no budget? Why is the minister acting like there is no budget? Because if you were to listen to the minister, he makes it sound like these 40% of the people that can actually, that are covered to attend to the private hospitals, he makes it look like these people are given this cover. They are not giving this cover. They are actually paying for it. They are working hard and they are paying for this cover. They are working hard. They are paying for the cover. And at the same time, there is a budget for such conditions. So why is the minister acting like there is no budget for the healthcare facilities? Why is the minister acting like there's no budget? There is budget. There is budget. And what is the national health insurance going to solve? What is the national health insurance going to solve when they cannot solve these issues that people are facing today?
Yeah. Minister, let me quiz you on that, because South Africa's GDP, about 10% of this goes to the healthcare system. As much as we want to say that there's not enough money within the public healthcare system, a lot of people talk to corruption, poor.
There's not a lot of money. Okay, let's say there's not a lot of money that goes into the public health. Why is that? Why is that? It goes back to how these people have actually governed, because if you have more people working, you will have more people paying the taxes. If you have more people paying the taxes, you will have more money for the hospitals. This is how it's like. So if they're going to argue that there is not enough money to cover the public health facilities, why is that? Why? The reason why there is no money is that people are unemployed. People are not paying the taxes. Majority of South Africans are relying on the grants that they are getting from the government. And why is that? Why is that? Who is responsible for the majority of South Africans that are relying on the social grants? Who is responsible for that? Who is responsible for that?
Within the GDP, about 10% of this goes to the healthcare system. As much as we want to say that there's not enough money within the public healthcare system, a lot of people talk to corruption, poor maintenance, the fact that the attitudes amongst the staff is not good because they are stressed, they are overworked, the facilities are falling apart. And there is not a cause for the fact that there isn't money. There is money going into the hospitals, but it's not going into the hospitals. I shouldn't say that. It's perhaps going into the pockets of a few that are working behind the scenes to corrupt the system. Perhaps you want to respond to that.
Leanne, let me correct a little bit. 10% is just too high. We're not spending 10% of the GDP. We are spending 8.5, which is also very high, because the World Health Organization has stated that if countries spend only 5% of their GDP on health, then all the people in that country ought to experience a good health outcomes, and everything will be better for the population in that particular country. We have far exceeded the 5% recommendation. We are at 8.5%. The problem, Leanne, which everybody is trying their best to run away from, is the fact that 51% of that goes to serve only 14% of the population. And the remaining 49% serves a whooping 86% of the population. Nowhere in the world do we find that state of affairs, that gross inequality. That must be taken into consideration. The issue of corruption.
But you had 30 years to deal with that. You had 30 years to deal with that. Now that Mr. Motsoaledi is the health minister under the GNU, he's going to come out and say that, no, this is what is happening. But truth of the matter is that the ANC has been in charge for the past 30 years. So what have they been doing about what you are talking about? What have they been doing about what you are talking about? You are talking about the people running away from confronting these issues. But truth of the matter is that what have you done for the past 30 years to address these issues that you are talking about? What have you done?
Inequality, that must be taken into consideration. The issue of corruption, I'm one of the people who fight corruption wherever I am, and you know very well that we don't tolerate it. But I don't think we can use corruption as a reason why poor people in South Africa cannot be served, why we can't fix the healthcare system, because there are corrupt people against us. We have done everything. Very recently on medical legal cases, we have called SIU, we are working with them, we have launched the anti-corruption summit. We are open to proposals on how this whole issue of funding of healthcare, the money should be taken care of. We are prepared to bring even people who have got skills outside government.
Yeah.
Having said so, Leanne, please do know that people follow money. If only 14% of the population is enjoying the biggest slice of the healthcare spend at 51%, all the good people who are good managers will go there. The good auditors, the good CAs, the good specialists, they'll all go there and leave the poor with very poor management. I mean, managers, because everybody is going there. So it's the situation that we want South African to sit with us and say, we can't go on with this situation. We can't keep on pointing fingers at each other. We can't keep on having Helen Josephs of this world, and we can't throw our hands in despair in the air. We have got to change this situation.
So, ladies and gentlemen, you heard it from the minister himself. The poor state of our healthcare facilities, it has nothing to do with corruption. It has absolutely nothing to do with corruption. It has nothing to do with corruption. This is what the Minister of Health says.
We do, but Minister, this is not new. This isn't new. When you go back and you look at articles and people complaining about the healthcare system, this has been for the longest possible time. So I don't think people are throwing up their hands. You've got doctors and nurses that are tirelessly spending their days and nights in these facilities where there's no water, the air conditioning is broken, the bathrooms are in a poor state, that there are no spoons for the patients to eat, that they are freezing in certain cases in their beds, that they are working in institutions that they don't even have medical supplies. And the reality is that we get back to the funding, which is there. It's not good enough, and I'm not. This is not against in terms of having NHI or not having NHI. I think we need access for healthcare for everybody. But the reality is, when it's managed in the way that it has been managed for all of these years, because the maintenance is just not there. Fires at hospitals, patients having to be removed, children being held in cardboard boxes. Patients dying in queues because they are not being attended to or being chased away, getting there at 3 o'clock in the morning and having to leave at 4, not being seen to. These are the stories that I am reading right now of South Africans when they encounter the healthcare system, that it's not acceptable, Minister.
Leanne, you are reading all the negative stories, yes.
I have to focus on the negatives because...
So, our Mutsualedi wants us to pretend like all of these negative things that we are talking about, they do not exist, simply because he's working on the problem. He's working on the problem, so everyone must not talk about what average South Africans are going through. He says that Leanne is focusing on the negatives. Leanne wouldn't be on the TV focusing on the negatives if this is something that people were not talking about. She's talking about the stories that average South Africans are talking about. She's relying to the minister what average South Africans are going through on the ground. And he says, no, Leanne, you are now focusing on the negatives. You are now focusing on the negatives. So what is it exactly does the minister want? Does the minister want Leanne to pretend like all of these stories that she's talking about do not exist?
You are reading all the negative stories, yes.
I have to focus on the negatives because I cannot compliment you and I cannot focus on the positives because I'm not here to give you a pat on the back for doing a good job.
This is what he wants. Unfortunately, Leanne, this is what he wants. He wants you to pat him on the back and say, Minister, you are doing the good job. You are doing the good job. Forget about these peasants that are complaining on the ground. Forget about them. Forget you are doing a good job. Bring your foot. Let me kiss your foot. He wants Leanne to do that. This is obviously what he wants Leanne Manas to do. This is what he wants Leanne Manas to do. How can you, as the Minister of Health, actually expect South Africans not to talk about these issues? How can you expect South Africans not to talk about these issues and only pretend like these issues are nothing but negative stories or the negatives? These are people's lives. These are people's lives. But no, the honorable minister, he wants Leanne Manas to bow down and kiss his ring. This is what he wants.
positives, because I'm not here to give you a pat on the back for doing a good job. I'm here to hold you accountable for what you're not doing. And this is where I'm saying it's not working. Yes, it works for millions, but it also doesn't work for millions.
Leanne, do you want to continue this interview by speaking alone?
No, please,
and
carry
say
on.
You are holding me accountable. No,
Please.
You are speaking alone all the time. The moment I open my mouth, you come in and say, but.
Not at all.
And
Minister, please on.
Now, Aaron Motsoaledi is trying to shift the conversation and make it look like Leanne Manas is attacking him. Now he's pretending like, no, she's not allowing me to speak. Speak. They brought you there to hold you accountable. They brought you there to hold you accountable. Now you want to shift the conversation from all of these issues that Leanne has actually mentioned to Leanne being nasty towards you.
You are holding me accountable. No,
Please.
You are speaking alone all the time. The moment I open my mouth, you come in and say, but.
Not at all.
And
Minister, please answer. Please go for it. I'm giving you the time. Please, Minister.
Thank you very much. You are going only for the extremes, Leanne. I'm telling you, the public healthcare system every year is treating 80%, 86% of the population, which are millions of people. You are right. Those don't appear in the media because the media only put those ones which are negative. The positive ones where they have faced the experience. You said it's not your job to put them out for people. You are holding us accountable. For instance, you're speaking as if we don't have any hospital plan or maintenance program. We do have. There are many new hospitals that are built in South Africa, and I'm promising you, I'm going to give you the list of all the infrastructural problems in our country. And there are many of them, and we're trying our best. But time and again, we do find Helen Josephs of this world, which breaks our heart, obviously. But I am saying because of what happened in Helen Josephs and many other areas where something went wrong, we should not throw our hands in the air in despair. We are busy trying to fix the system and the issue of universal health coverage, which you say you support, but you put a big but. And that but is saying it should not happen because there are people who cannot manage. But I am telling you, we want to equalize the system so that we get good managers on both sides of the systems. And I'm telling you, the other 14%, which is managed very well, is because it has got huge amounts of resources. And I don't understand why you run away from that and say, but mismanagement and corruption. Yes, it happens because there are no good managers, because all the good managers will run where resources are. And that's why we want to equalize the resources. But I want to...
So it is not the fault of the ruling party that there are no good managers in hospitals, in public hospitals. It is not the fault of the government. It is not their fault. It is not their fault that there are no good managers. There are no good managers in the public healthcare facilities. It is not their fault. It is not their fault.
Will run where resources are. And that's why we want to equalize the resources. But I want to give you a list of all the hospitals that are being built. I can only remember 4 off my head, big ones. We are building an academic hospital in Limpopo. It is busy under construction. In Mpumalanga, they are building 2 brand new big hospitals, one in Bushbuckridge to replace the hospitals in which I worked in 1985. One is being built in Middelburg. In Limpopo, apart from the academic hospital, we are rebuilding Siloam hospitals, and I can give you a list of many more all over the country, clinics and hospitals that are being built. 40.
Truth of the matter is that you can build them all you want, but the thing is that you cannot manage them. You cannot manage them. So you can build 100 hospitals, but you cannot manage them. That is the thing. You cannot manage them.
40% of all the clinics in the country, 40% of all the clinics in the country were built during the era of democracy. The other 60% were built from 1994 backwards up to 1652. So it's not that there's nothing happening, simply because here and there we still find big problems.
Yeah.
Leanne, I've gone through worse things than what you are going through now.
Yeah.
I was the first MEC for education in Limpopo. where lots of kids were under trees and in dilapidated structures. We sat down and started building them exponentially, and we never threw our hands in the air. We built them. The situation is much, much better than when it was in 1994 in most of our schools.
Okay.
In 1986, yes. So we are going through a situation which some of which we have seen before, but it does not mean that there are no plans to improve it.
Yeah.
Unfortunately, it took them 30 years to actually focus on these issues. It took them 30 years. It took them 30 years because if we were being honest, there is no excuse right now for the children in this country to still be studying under the trees. There is no excuse why the children are studying under the trees as we speak. There is no excuse. There is no excuse why the children are dying in the pit toilets. There is no excuse why there is no infrastructure for the children. You look at the provinces like the Eastern Cape, you look at the province like Limpopo, some of the parts of the Free State, those conditions, they still exist. But truth of the matter is that it was not supposed to happen. It was not supposed to happen. Today, as we speak, 2024, there are children that are still dying in the pit toilets. So there is no excuse. Just because you say you are working on it, it doesn't make it right. Just because you say you are working on it, it doesn't make it right. Why didn't you work on it for the past 30 years? Why didn't you work on it for the past 30 years? Other countries in the world, they are talking about the technological advances and how they are working with the technological advances. But here in the country, we are still talking about building the primary schools because there are children that are still studying under the trees. We are talking about building the toilets in the rural areas in KwaZulu-Natal because children are dying in the pit toilets in KwaZulu-Natal. But truth of the matter is that in 2024, we were not supposed to be having conversations about the pit toilets in the schools. We were not supposed to be that. We were supposed to be competing with other countries in the world and talking about the technological advances. But here we are, the 30%ers of the world. 30%ers of the world, here we are. 30%ers of the world, here we are. Unfortunately, it took you 30 years. It took you 30 years. Now, these hospitals that you are talking about, yeah, they are being built recently, fine. But what happened for the past 30 years? What happened for the past 30 years?
Yeah. So, Minister, thank you for responding and certainly talking to us about what's being built, what's being done to help with inside. And we know that there is work being done inside, but we have to highlight what isn't working. And one of the big complaints, and I must say, through all of the comments that we are receiving and the feedback that's being given, one of the big issues, and I think perhaps maybe you need to address this, is the attitude of doctors and nurses within these institutions, because that seems to be a very big concern for people as well. Is it perhaps because they are overworked, that the system is too busy, that there is just too much going on? Or what is the case? Because many, people talk to the oath that doctors take and that the treatment that they are giving the patients is not right. Now, how do we fix this? Because at the end of the day, being in the medical system is facing patients all day long. And when you are not treated well, this is the worst thing for human dignity.
Well, the people you are speaking about have taken an oath of office. And among the things they've promised is how to handle patients with empathy. But in order to make sure that we supervise that, we have established the Office of Health Standard Compliance to make sure that hospitals and facilities comply with standards. We also have institutions like the Health Professions Council of South Africa, the Nursing Council. We even established the UMBAT office. If you remember, Leanne, I am the one who established the office of the first ever health UMBAT in South Africa. And people ask me, what is this UMBAT? What does it do? I said it's a public protector of health. Somebody who's going to try and protect the public, like the public protector. And that's why we appointed Professor Malrab Turumakova as the first health UMBAT. And you know his work. You've seen what he has done, starting with Life is the Main. Now, in Helen Joseph, I am writing a letter to the present UMBAT, because if it's true that doctors acted the way they did, then that's unacceptable because they took oath. During our time, Leanne, we were more...
why don't you make investigations and find out how many people have been mistreated in various hospitals, why don't you just make an investigation? Because if you are only going to write a letter to find out about the doctors in only Helen Joseph hospitals, what about the patients that have been mistreated across the country? What about the patients that have been mistreated across the country? Come on, guys. Come on. What about other patients that have been mistreated across the country? If you would just visit the public healthcare facilities and just listen to the people, listen to the stories, I'm sure that there are hundreds and hundreds of doctors that have mistreated the people. There are hundreds and hundreds of nurses that have mistreated the people, especially in the clinics. We know in the clinics it is worse. In the clinics it is worse. It is worse. So why don't you do an investigation and actually try to get an understanding and to see how many hospitals are facing the same conditions that is facing Helen Joseph Hospital, instead of just pretending like all of these problems are only existing in Helen Joseph Hospital. It doesn't make sense.
Overworked than ever. I know that people get angry when you say this, but I'm telling the truth. You can go and check.
Yeah.
I have run some hospitals, being one. I ran many hospitals in Limpopo where you are working alone, even doing a CSR alone, which is against the rules, but simply because you want to save somebody who is about to die. We have done that before, so we know people are overworked, but that's not an excuse of being rude to patients. Yeah. Lastly, Leanne, it's very funny. Quite a number of our health workers, both nurses and doctors, do work in both sectors. We have got a lot of nurses who do what is called moonlighting, going to work in private hospitals, where they work very, very well and smile all the time. And the following day, they are tired, they go to the public hospitals and they meet poor people. It looks like when professionals work among poor people, they change their attitude, unfortunately. And that's one of the things that we are going to fix through the Office of Health Standard Compliance, through the UMBAT. As we speaking now, I'm here in Magalis. We're spending the whole week here. Yesterday, we brought the CEO of the Office of Health Standard Compliance to show all the MECs of the country, they're all here, to show them what they found when they inspect hospitals, where the weaknesses are, what needs to happen, where are the problems. They showed them pictures, some of which, of course, are like Helen Joseph, but they also showed pictures of the good areas, which, of course, you won't show on TV because you said you only want to show the bad ones. But the Office of Health Standard Compliance was showing and saying, here you have passed 100%, here you have failed, here you get 0, here you get 50%. So we are definitely doing something about it.
To me, it sounds like the minister is just being defensive. The minister has just been defensive because he is not even acknowledging all of these things that people are saying. He's not been defensive. He just wants people to congratulate him about the few cases where he seems to be doing work, but he wants to say nothing about all of these issues that South Africans have been complaining about for the longest time. So, guys, I don't know, man. I don't know, man. These are the people that are telling you that they can deliver the healthcare, national health insurance. These are the people that are actually expecting you to believe that they can deliver the national health insurance. They don't even want to be held accountable about the current state of our public health facilities. They don't even want to be held accountable. It is absurd. It is absurd. Guys, please tell me what you think. Go to the comment section. Don't forget to hit that like button, and the most important part, subscribe. My name is Thomas Mabaso. I will see you next time. Bye-bye. Guys, I have